So, so to begin with, I just want to touch a little bit information on the COVID infection itself. I think we all know about it, but sometimes it's a good reminder to sort of get an update of how it's affecting the human population. We know most people who get it will have a very moderate respiratory illness and will recover within the period of 14 to 18 days. But it can also cause complications like pneumonia, one of the key things that it causes, the building up of fluid in the lungs. It can also cause acute respiratory distress syndrome, which needs oxygen and ventilation. And this is where people end up in hospital, and then people might need to be in the ICU who will need to be intubated as well. It also can cause sepsis, which is a problem these days. We are hearing about long COVID, where people have lasting harm to their lungs and also some other body organs as well. We all carry microorganisms, and normally with any viral infection, there could be a secondary infection from your normal flora. And this is what is referred to as a superinfection by other organisms. It's normally spread through droplets of saliva or discharge from the nose. And this is why it is now made mandatory that you wear masks, because every time you sneeze, if you are an infected person, when you sneeze or cough, you are releasing a whole lot of viral particles into the air, and people close by can easily get infected as well. So the mask acts as a protection against people taking it directly. Generally, we have found that with this particular infection, there's an incubation period of 2 to 14 days. And this is why if you are infected or you've been to a tier site or exposure site, you are asked after getting tested to isolate for 14 days, because symptoms can take that long. It can come within 2 days or it can come within 4 days. Like if you look at the people in hotel quarantine, many people traveling from overseas are put into hotel quarantine for 14 days. The reason is that if they are carrying the virus, this period will be the time they would start to exhibit. But we've seen sometimes in some people that they could show after the 17th day, even 21 days as well. Now, some people can be asymptomatic, where they don't have any signs of infection. Some people during the incubation period are called symptomatic. They don't show signs, but they can easily infect other people. So it's important that anyone who's exposed takes precaution and also follows the quarantine routine that is expected. Now, in the world, there's over 208 million cases that has occurred up to date. About 4.37 million people have died due to COVID. In Victoria, in Australia, we're lucky. We have had about 37,754 cases. It's gone up today. We have had more numbers. And then in New South Wales, we're having also deaths occurring. So around 2 days ago, the numbers were about 947 deaths up to date. Most deaths occurred last year, especially in Victoria. We had about 600, 700 deaths that occurred in aged care facilities. Now, when we talk about COVID vaccines, we must remember that the vaccine is not the only solution. Vaccine is part of the solution, and that means having COVID-safe behavior, following the instructions. So, for example, wearing a mask, as I mentioned, why it's important to wear the mask. You're not only protecting yourself from getting infected, but you're also protecting others from getting infected if you are an infected person. Hand washing is very important. We are constantly reminded wherever we go, wherever we travel and we come back, make sure you wash your hands or use hand sanitizers. It's good to carry one of those in your cars or in your bags. Males hardly tend to carry them in their pockets, but it's good to carry one of those hand sanitizers as well. And even if you go to the supermarkets, advisable, they have the wet tissues, hand sanitizer tissues. Use them to wipe down the trolleys when you go inside as well. Wherever you go, whether it be a small shop to buy your newspaper or milk, or you go to a supermarket, or you go to a large center, or even if you go to a place of worship, it is important to QR code, because the need for the QR coding is not just for the government to get information. They're not interested in the information. They need this information for them to trace people who have been to a particular site. So the moment we know that somebody has gone to a site, and that's considered to be a tier 1 site, people who have been to that site in that particular time frame, an hour before or a few hours after, are contacted, and they are asked to test and also quarantine until their test results come. If they've been to a tier 1 site, they are considered a primary close contact. They are asked to quarantine for 14 days, because even though you could have got infected, you might not be showing signs. That 14-day period is the time they could understand. Getting tested is important because many of the symptoms shown by COVID are very similar to the common flu. We are in the flu period, like the runny nose, cold, fever, headaches, sometimes stomach pains. And with COVID, you also sometimes lose the sense of smell and sense of taste. So if you have any symptoms, don't assume that you are having the normal cold or a flu. Get tested. I know it's a bit harsh because when you get tested, it's up your nasal passage, but it is important because you don't want to be the person who passes COVID on to somebody else. So it's important to follow those rules and stay at home. Normally, if you've been to a tier 1 site, just to remind you, it's 14 days. But if you have been to a tier 2 site, you then get tested and wait for your results. And once your results come, if you're negative, you can leave home. Now, the vaccination and testing is free for everyone on Australian soil, whether you be a citizen, a resident, an international student, or you are a visitor here. You are also, if you are a refugee, anyone on Australian soil, whether they have a visa or don't have a visa, have a Medicare card or don't have any insurance, they are all eligible to get vaccinated and tested. It's free. No one should be charging you. If anyone is charging you, they should be reported, because it's against the Australian law to charge you for either the testing or for the vaccine. So we all know the virus, and the reason that it's called the coronavirus is because of the structural proteins or called the spike proteins on the surface. So this gives the shape like of a crown, and that's why it's called a coronavirus family. So we had SARS in a few years back. Then we had MERS in the Middle East as well. At the moment, we have 2 key vaccines that help us in handling this pandemic. One is the Pfizer vaccine, which is an mRNA vaccine. And mRNA vaccines are not new to mankind. It's been there since 1961. They've been working and doing a lot of research. The last one they used, the mRNA vaccine, was for the Ebola outbreak in Africa. The mRNA vaccine was the one that was used to sort of vaccinate people. The other vaccine that is normally used it follows a normal pattern, is the AstraZeneca vaccine, which is the normal traditional vaccine method of using a vector. You incorporate the genetic material that gives rise to the spike proteins, and then in a harmless virus, in this case they use the chimpanzee virus, and that is injected into the human body. In both cases, the human body then produces the spike proteins because we got the genetic material given to us. Then immediately your human immune system is kick-started. It produces the antibodies that will destroy the spike protein. Now, generally what happens is this then remains in your memory. And this is what vaccines do. This remains in your memory. And if you do get infected by this particular virus, your immune system is kick-started. It produces the antibodies that then destroy. All vaccines, there's no vaccine that can give you 100% immunity. So with both Pfizer and AstraZeneca, what has been found out that they will, after the second dose, they'll give you over 90% efficacy or over 90% immunity. Now, so just to remind you that vaccines are not new again. We have had so many vaccines that have been given to people, whether it be polio, tetanus, measles, lots of childhood vaccines we get, but we also can get vaccines when we are traveling to certain countries. Now, in Australia, over 15 million doses have been administered. I heard this morning mentioned that we have now surpassed the 16 million mark. In Victoria, we have been given over 4 million doses of both vaccines. Now, worldwide, roughly about 4.8 billion doses or nearly 5 billion doses of vaccines have been administered. At current state, there are about 17 vaccines that have been used right across the world. There's about 31% of the population has had one dose, and 24% has had both doses as well. Now, when we talk about the virus, viruses tend to mutate. This is a very common feature in viruses. Like take, for example, your flu virus. Every year we get a vaccine which is different, which is addressing not only the old flu strains, but also addressing the new strains that develop over the year. So similarly with the COVID virus, since the beginning in 2019, the virus has been able to mutate. It mutates in the human body. So in many cases, it has mutated in different parts of the world. Like originally, from a scientific point of view, they were labeled with numbers and lettering. Can you imagine if we were to refer to Delta as B16172, everyone would be so confused, they would not know what they're talking about. So after that, they named them by the country where it originated. And now they renamed it by the Greek alphabet. So at the moment, the 4 strains that are of concern to us is the Alpha, Beta, Gamma, and Delta. We also know this is not going to end. There have been more mutants coming as time goes by, and we already know there's a Lambda strain now out in the community, especially there are a few cases that are mentioned in New South Wales, but it originally came from Brazil area as well. The good thing is both vaccines are effective against this Delta strain. It might be less, there's lots of studies showing that it's dropping, but this is over a period of time, but still it gives you some level of immunity and also prevents you from getting a full-blown infection as well. So normally with vaccines, there can be side effects. This is common, whether you take the flu vaccine or you take some other vaccine, there is some side effects. So the general side effects is pain in the vaccination place. So normally on your arm, some people will suffer soreness and pain, tiredness, headaches, aches, and fever. Fever is very rare. Again, you can see it's a low percentage. But these are common side effects. It refers sometimes that your immune system is working very fast. In some people, you might not see any of these side effects. And I'm the best example. I always say I'm the best example. I had AstraZeneca. I had no side effects. It doesn't mean the vaccine is not working, but it is each individual reaction, the immune system kickstarting or working in a different way. Now, one of the key things that we are always concerned about is the anaphylaxis reaction. This is like, for example, like sometimes when you take certain treatments, or if you take some people are allergic to peanut butter. And we have known that some people, children especially, if they do take peanut butter and if they're allergic, it can also be fatal to them. So immediate treatment can save the person. So similarly here with the case of Pfizer and AstraZeneca, there's possibility of somebody getting an anaphylaxis reaction. This is why when you go to get vaccinated, you are asked to remain in the place for 15 minutes after the vaccination. You're not supposed to leave there, because if you do get this anaphylaxis reaction, this happens very fast within that 15-minute period. You can be given the necessary medical treatment and supported as well. Now, I just wanted to cover all these aspects. There's been lots of changes over the last few days, and it might be very confusing to people. So generally, people under 60 are being offered Pfizer. That was how it started off. People over 60 were offered AstraZeneca. Subsequently, now in the recent months, since that outbreak in Sydney, people between the ages of under 60 and over 40 were offered vaccination. People 18 to 39 are now being offered AstraZeneca at the moment. The Prime Minister has just announced, on Friday, he announced that from the end of this month or the 30th of August, that everyone will be eligible to get vaccinated. So there will be this barrier that will be removed about the age limitation. But there will be still that offering of AstraZeneca for over 60s and under 60s to be given Pfizer. We also have started immunizing children. Now children 12 and up to 15 years are being offered Pfizer. They have been prioritized, but again, we cannot vaccinate all children at this stage. So they have specified 3 groups of children who will be vaccinated. One is children with special medical conditions that are of high risk and who could be having severe asthma, diabetes, and other conditions. Aboriginal children 12 years and up to 15 are also being vaccinated, and children living in remote areas because their access to medical treatment or their access to get quick, fast treatment is very harsh. So it's better to get them vaccinated. So these three groups of children, 12 to 15, are also vaccinated. Now, under 60s, when they were looking at various conditions of vaccinating, they also looked at key people who are exposed to this illness and who could easily get infected. So you had the frontline workers like healthcare workers, aged care workers. So you can see even in Sydney now, when they're talking this morning, I was listening to the statement by the chief medical officer there. The person, two people who have died, two elderly people who have died in aged care facilities, they got infected by one of the staff members. So we know the federal government has introduced a policy. From the 14th of September, every single person working in an aged care has to get vaccinated. There is no question about it. They'll all be vaccinated. If they are not prepared to get vaccinated, they will not be allowed to work in an aged care facility. So similarly, there's a whole lot of other people who have been offered. Now, we know pregnant women have been offered the vaccine as well. Apart from that, we have also got two other vaccines that are coming into the system. There's Moderna, which is similar to the Pfizer vaccine. It's mRNA vaccine, very same type, might have different ingredients, but the key component is the mRNA that is incorporated into the vaccine. That should be available for us by end of September. Then we have another one, which is the Novavax. It is still to be approved by the Therapeutic Goods Administration. It's a protein-based vaccine. Hopefully, we should have them all next year. So we will have 4 vaccines available going forward by end of December. Now, people over 50 can, there are over 50 vaccination centers run by the state government. These are the MASM sites, or you can pop-up sites that appear. You can go to the portal site, portal cvsmvic.gov.au, or call the 1-800 number 615-398, and you can make a booking to get vaccinated. Sometimes when there's an outbreak, we sometimes set up pop-up sites. And there sometimes people can do a walk-in, but today, because of the supply area, it's best for you to make your bookings, and you'll get your bookings to get vaccinated. The GPs who vaccinate and GP respiratory clinics are supported by the federal government. Now, so there's and they are given also vaccine doses to vaccinate people. Now, every GP is not on board with the vaccination program. They have to apply to be one of those vaccinators. They have to undergo training. They have to also get their clinics checked, and then they are allowed to vaccinate. If people are unable to get vaccinated by the normal support networks, there are disability liaison officers who can assist people to get the vaccine as well. So I'll share these slides, so you should have those links to those forms as well. Now, we know that pregnant women are routinely offered Pfizer at any stage of pregnancy. So again, there's a lot of fallacy out there saying women that the vaccine affects fertility. It's all not correct. There's no scientific evidence to say that it happens. Any woman who's planning to get pregnant or who's pregnant can take the vaccine without any problems. There's also evidence that pregnant women and breastfeeding women can also can take the vaccine. When you work the vaccine, it's much more safer to get vaccinated than getting COVID and also then infecting your unborn baby as well. So if you have received the AstraZeneca as your first dose and you are pregnant, you need to get the second dose, you can either take AstraZeneca or Pfizer is offered to you. The preferred vaccine is Pfizer, but you can get AstraZeneca as well. Now, it has been found, research studies have shown that babies are protected by the mothers through the placenta, by the antibodies produced in the mother, or through the breast milk from the mother as well. So there's a lot of supportive evidence, scientific evidence to support, and this is why ATAGI has approved Pfizer to be given to pregnant women or women who are planning to get pregnant as well. Now, another thing, especially for international students, and especially we have lots of guests who have come here before COVID started and have been unable to go back. So if you don't have a Medicare card, you can apply for an individual healthcare identifier. You go onto the website. My colleague Pasu might put up that connection or that link on the chat function. You can go to that site. It takes about 5 minutes. You can easily get the individual healthcare identifier, and then you can make your bookings. So if you have either a Medicare card or an IHI, you can also make a booking with your GP as well. But if you do not have a Medicare card or you don't have access to an IHI, you can still get vaccinated. As I said, every single person on Australian soil can get vaccinated. Only difference is you will have to go to a state vaccination clinic. You can't go to your GP or to a private clinic. So again, when you do the booking, you say you do not have a Medicare card, they'll give you the appointment. You turn up with some sort of identification and you will be vaccinated. This again was a question asked by many international students. I think they are concerned about this. So if you're coming from overseas, you have had a first dose of AstraZeneca or Pfizer. So when you come back here, you will be given, it is accepted, you will be given the second dose of either Pfizer or AstraZeneca, depending on what vaccine. So you need to have a proof to say which vaccine you took initially. Now, sometimes you could have taken some of the other vaccines. Now, if you go to the WHO site, they have identified a whole lot of vaccines. It's called vaccines that have been approved by WHO. If you have taken any of those vaccines, you will be given the second dose appropriate to your age group. So if you are under 60, you will get the Pfizer. If you're over 60, you will be given the AstraZeneca. So if you had if you had both doses overseas, you will be considered to be fully immunized as well. If you have taken a vaccine that is not approved by WHO, then you will have to start the vaccination process here from month. So you have to get both vaccinations. So generally for AstraZeneca, it is recommended that you take it the first and second dose with a 12-week interval period. But when we are in outbreak mode, you can either take it in 10 weeks or you can take it in 8 weeks. With Pfizer, normally the time period is 3 weeks, but in Victoria, we have extended time period to 6 weeks to get more people vaccinated. So you can take it up to 8 weeks as well. It is perfectly okay to take it, but it's good if you can get it on time as like anyone else. Now, our work is not, talking to you is not the only thing we do. We also encourage people in the community because your voices are the best, strongest voices that can send the message to your community. You're trusted, your GPs in your communities, your scientists in your communities, people, faith leaders, community leaders, you are the trusted voices in the community. So we are engaging with a whole lot of people to see if people are interested in being part of our Vaccine Champion program. So we will, if you're interested, you can email me and we can send you the forms, or email Pasu. We can send you the forms. And so you fill them up and then we run training programs. And I'll talk to you about one of the trainings we are running on the 9th of September. So that's one way of it. We're also having doctors on board. So when we do sometimes talk to some communities, we take doctors with us who might be able to talk to them in the language of that community, because sometimes people might not understand English. So we take people with us to be able to talk to them. We also like to hear personal stories because they're very powerful. Like yesterday, Pasu and I were in a Cook Island community. We were talking to Cook Island community, and we had some powerful messages from some elders. We also had a powerful message from a young girl who is at the moment quarantined in a hotel with the whole family. She spoke, we kept her identities, like we covered her identity so no one knew who she was, but she was able to convey that powerful message that she said that she did not think COVID was true, COVID was not correct, but she is now seeing what damage it has caused. Her father had to be then, apart from going into the hotel, ended up in hospital. Her auntie, who was with her 2 children, Her auntie fell sick and had to be rushed to hospital. And the two kids of that auntie are now in one of those rooms on their own. And they do not even are able to go across to meet them or see. So she was talking of experience. So these are powerful messages to get across to community. So if you do have these messages, please use them. Please use people who can talk and us also. We also address a lot of vaccine misinformation. There's a lot of myths out there, and it's easy for people to get confused by all this messaging that comes from the outside communities. So the advantages of getting vaccinated, it's very effective. As I said, it stops you from getting seriously ill and also stops you from getting hospitalized or ending up in ICU. The vaccines, both doses, after both doses, you can build up over 90% efficacy as well. One of the key things when we talk about CAL community, it's not just you and your family that makes this community, it's your extended friends and family. And this is why when we get vaccinated or we take the precautions, we are not only looking after ourselves and our families, but we are also supporting the wider community and looking after them. There's a fallacy about vaccines causing problems. COVID vaccines cannot make you sick with COVID. That is not a correct statement. Scientific evidence has also shown that the vaccines can mutate, sorry, not the vaccine, the virus can mutate. Having vaccinated, it prevents that mutation occurring as well. Generally, when you get vaccinated, it takes about 2 to 3 weeks after the first dose for you to build up immunity. So it's important to get vaccinated in advance. And this is what vaccines are all about. Vaccines are not a treatment. Vaccines are not a cure for infection. It is a preventative measure that you take in advance to safeguard you from getting highly sick as well. If you have been, or if you're already infected, the vaccine will not work. And if you have had COVID, it is recommended that you wait for 6 months, because during that period, the antibodies that are produced in you will also be active and support your immunity to a great extent. But you get vaccinated towards the end period of that 6 months. My final message is over 4 billion doses have been given. We are lucky that the vaccines, any treatment, medical treatment that is given to the Australian community is monitored by a group called ATAGI. They are a group of specialized, world-famous medical people and key policy-making people. They're independent from the government. They observe everything. They take the data that comes and make the decisions. Safety are very rare, so you have very little problems. You must, if you have any medical condition, please talk to your GP. Don't, sometimes you can ask questions in a forum, but really that person won't understand what your comorbidities are. So it's important to talk to your GP, make the informed decision by talking to them. Again, seek proper advice. Don't go onto Google and other sites to find information. Talk to people who know this area. Talk to people who can give you the correct advice. So avoid the misleading statements that come up in the papers. So these are some sites. This is the workshop I was talking to you about. If you're interested in being a vaccine champion, this is run by Professor Margie Danchin. She's a world famous person who works on vaccines. She's a pediatrician in the Murdoch Research Institute, Children's Research Institute, and she does very good training in this to teach people how they can go out into the community and also talk to their members and friends as well. If you have any questions, you can ask me. Thank you very much. I just wanted to mention the Premier has started this campaign of 1 million doses, 1 million reasons to get vaccinated. So we're hoping to get 1 million people vaccinated in the MASM sites by mid-September. So as much as you can, please talk about vaccines to people and how important it is to get vaccinated. Thank you very much. I'll end here and I'll end here. I just want to touch on one thing about TTS, you know, the thrombosis or clotting. This is, people talk about it with AstraZeneca. There's a lot of concern. One of the key things here is to remember that it's very rare. It's a 0.0004% compared to getting clots due to COVID itself. 16.5% chances of getting clotting by COVID. And remember, at one time, when people were flying, there was the deep vein thrombosis. like the cases again is higher than getting clotting by COVID. I'll stop sharing, and I'm happy to take any questions from people.
Thank you, sir. I would like Dokina or Pallavi to do a vote of thanks, and then we'll take questions. Yes, Ashim. Okay. You can.
Yeah. Can you hear me now?
Yes.
Yeah. Thank you, Dr. Mohideen, for your very, very informative talk. And of course, Pashu Sharma has been providing all those links. So that will be very, very useful. I have got just one question about the slide which you showed, saying the vaccine side effects. In the table you have shown, Pfizer had got certain amount, and then you have got AstraZeneca certain amount. So when I go to the last line, which is the anaphylaxis, for example, it says 4.7 million per million for the Pfizer and 1 per million for AstraZeneca. So can you explain to me why people are so afraid about taking the AZ rather than Pfizer? Because that's causing a lot of confusion about, because I just read in the newspaper today that there are about 250,000 doses of AstraZeneca are sitting there doing nothing. So if you can explain that, possibly that would be quite good. Thank you.
Thank you for the question, and it's an important question. Remember when AstraZeneca was introduced, it was discovered by the Oxford University scientists, and in UK, majority of the people have got vaccinated by AstraZeneca, and then we started vaccinating as well. And today, 187 countries are using AstraZeneca as one of their vaccines. Now, what happened was, when there was the clotting that started to affect younger people, media went haywire with it, because all this was story about these vaccines have come out so fast, it's not been properly tested, and the media made such a big fuss about, like, made so much fear in the community. And then you had also some people, some doctors went out and started talking about it. We know it has happened, we know there is clotting, but it's a very rare condition. But because the media, like for example in Australia, when we had the first 2 cases, the headlines was, people are dying of clotting, people are dying from AstraZeneca. So there's a lot of fear driven in people. And then, you know, in UK, the UK health department made a very decision that people under 30 were not going to be given AstraZeneca. It's people over 30 who are given AstraZeneca. In Australia, the Federal Health Department made a very conservative rule and said people under 50 will be given Pfizer and people over 50 will be given AstraZeneca. So when they made this rule again, so there was this story about, oh, that means it's a problem for people. So the older people felt that they were being discriminated and that they were exposed, that people just wanted them, even if they get exposed, without realizing this is a very rare condition. And then you remember, they also then decided within a month or two, Atagi decided to move that barrier to 60 and below, because what they found was some women in the 50s were getting the clotting. So it was a preventative measure that even we don't want to lose one life with this process. So it was to safeguard as many as possible. And today, like for example, in Australia, we've had 6.5 million doses of AstraZeneca given. We have had 74 cases of clotting. And out of that, only 7 people have died, unfortunately. Initially, many of the people who died due to, because initially they didn't know what was happening. But today we know with the clotting that it can occur between the day 4 and between day 4 and day 30. And there are also some of the symptoms that people can look out for, like, you know, the arm being sore, headaches, difficulty to breathe, lots of symptoms that normally people would seek medical attention immediately without ignoring it and saying this is not an issue. So this way we have been able to treat a lot of people, and so people have all recovered and gone back to their normal lifestyle as well. So it is this media made this lots of fear, and so people, without understanding, and this is what we do now, talk to people, explain that it is safe. And even today, lots of people are taking AstraZeneca. And like I was reading another article, which is coming out from Oxford University, another person has said that the immunity in AstraZeneca could last longer than in Pfizer. So it's interesting, like we are still getting more data coming. So people might then start shifting again to AstraZeneca, say, oh, I'm getting longer immunity. So it's an interesting, and like with Pfizer, we know today that like in Israel and in USA, young men under the age of 30 are developing myocarditis. So there's another side effect. So no treatment has 100%, you can have some other side effects. So again, we could have a shift of people fearing this sort of treatments as well. And we are getting Moderna. Very soon people might say, I don't want AstraZeneca, I don't want Pfizer, I want Moderna, which is the latest new one to treat. So, but it is this, I think, it is talking to the people and explaining that you don't have to fear, there is treatment available, we can look after and make sure that you look for these symptoms. If you go to the Atagi website, it gives you all the symptoms that possibly can occur and get treated as soon as possible.
Yes, doesn't it raise the question is that why isn't the government producing all these data which we have given here to the general public via television advertisement and things like that? Exactly. Because not many people go to the website and read all these documents and things like that. What they see in front of the TV is much more effective than actually reading the article in the web, on the internet or whatever. So what I'm saying, why the government is not encouraging this fact that anything you take, any vaccine you take, will have some side effect. And it, of course, depends on the person who is taking it.
Exactly.
So why doesn't the government try to do that?
Thank you. I think that's one of the best suggestions. I think we will convey this, but I think I'm not sure people who do deal with advertising and how they look at things, sometimes, because like Pastor and I were at another session, which was run by the department, that got people to come and talk about the negativity sometimes, and they were suggesting that we should not talk about any negative things, we're supposed to talk about positive things. So sometimes it's a human mind, when you talk about hesitancy, it's considered to be a negative connotation that really saying, no, this is the reason you do these things. So I'm not sure. So it's I take the point on, because I think it's a good point. I think maybe the government, whoever does their promotions, maybe need to think about how to promote AstraZeneca in a more favorable and address these concerns. Yeah. I think it's a good thing. I think. Thank you.
Thank you very much. Thank you.
And just to add to that, I mean, I saw this presentation last week, and based on this information, I actually went and booked my dose on Monday. But I went to the GP, and the GP sat and explained me for half an hour why I should go for Pfizer. And I came back. I mean, he didn't exactly say it should be Pfizer, but he said, consider, you don't seem confident. These are the things when, and this has happened to other friends as well. Now, my question would be, again, the government is giving one message, and some GPs are, or probably a lot of GPs are giving this other message for AstraZeneca. So, I mean, that's where the confusion is. I came back home absolutely confused, and now I'm like, what should I do?
I think this is human nature. This is, and I've heard this not only from some GPs, but also from leaders in the community, because they, because of that 0.004% of chance of happening, so they don't want to be the one to have told their friend or colleague or patient that, I told you to go and take AstraZeneca, and now you got the clot. So this is human nature. We never want to be the bearer of the, whatever happens. So unfortunately, it's I think lots of doctors are promoting, because they realize, especially with the younger people, it is important for them to get, because we are in a state, look at the numbers, every day it's growing. Because with this Delta variant, like with the earlier ones, if you had one person in the household sick, it's one person. You didn't, but today with Delta, you have one person in that house, the whole house is going to get Delta. And this is what we are finding, like, for example, in Shepparton, that one person got it and his whole family and his parents and his relatives who are staying in the next door houses, they all got infected. So we are dealing with a very strong variant that can spread very fast. And this is why the numbers, like you hear every day, they say out of the whole lot, many of them are being in quarantine because the family is in quarantine. Like if you even take Al-Taqwa, the school where that one teacher who got infected from outside, and then she came to school and then people got infected. Like initially when they did day 1 testing, they had low numbers, but today in day 13, they had 34, 40 odd numbers because the families get infected. You know, the numbers are coming out from the families.
I have got, sorry, I'm asking too many questions.
I
I have got just one more question, because you mentioned about the community leaders should pass on the message to their community, right? Now, the question I'm going to ask, do the community leader, whoever it is, has got the legal backing of the government? The reason I'm saying that, suppose I say to you, for example, oh, just no problem, you go ahead and take it and blah, blah, blah. Now, if something goes wrong, then he or she will say, you told me to do that. Now, is there any sort of, this is just a question people might ask, right? So that's the thing I'm thinking, because I come from a background where I have worked with the community for a long, long time. So people will ask that sort of question. So what answer do you have for that?
Very good question. Now, the way we go about, and even when I do the talks, I always say, seek your doctor's advice to make that informed. The terminology that they use is informed decision. So you are seeking from your doctor, like we can give advice and say, yes, you can get vaccinated. This is a key message we are saying. Talk to your GPs to make the decision whether you're going with AstraZeneca or Pfizer. So the GP has that indemnity and all those things to make that decision and support you. So he's going to consider, like, for example, even with, let's say with some of these antibiotics and treatment, if we, like I always tell my students at Monash, I used to say, when you go and get an antibiotic, how many of you read that big leaflet, 3-4 page leaflet? No one of us reads that. If you read that, you'll never take that antibiotic, because the side effects of the antibiotic is so bad. We say, I'm not going to touch it, but we just take it because we want a cure, we want a solution. So it's important to talk to, and you know, even if you go to a doctor to do a surgery, the doctor is also going to say, possibly this could happen, you know, you could stop, something could go wrong, something. They always give all that information first. And are you going to say, no, I don't want to get the surgery done? You are going to go ahead and do that. So I think that's why I think that informed consent, informed decision is very important in any medical. I hope I answered your question.
Yeah, thank you. Thank you.
I've got a question. In terms of AstraZeneca, now I have taken Pfizer. I'm fully vaccinated. My husband, who has taken AstraZeneca, now he had, once he had his doses, you know, he had this, you know, he had this pain on his arm, which happened actually for both. Now, as you were talking about the clotting, is that related to any clotting, or is it a side effect? I mean, he didn't like nothing happened, but I just want to be sure.
Yeah, that's not the clotting. That's just any side effect. Some people get it after the first dose.
Yeah, but that remained, that kind of, you know, that pain actually is still there.
Yeah, I would advise him to go and see the doctor if the pain is. How long since the second dose?
Second dose was, I think, a month back.
I would ask him to go and see his doctor. You know, maybe he's got some other thing that can also cause that pain, because that's very important. Like, I'll just, Pasu, you don't mind me talking about your experience of Pasu at Pfizer, and after the second dose, he came to work. I remember we all met, we were working in office. He came the next day. Then he was out for 3 days.
Yes, I had my second dose of Pfizer. I was just knocked down. I had terrible fever. I couldn't move. I was really, really sick. And one more question regarding children's vaccination. Now, I know our Prime Minister has announced for children vaccination from August 30th. I actually didn't wait. I didn't hear him properly. And I started, I rang the booking and I started making the booking. They said, no, you can't book right now. So when is that booking starting? And do you have any information on that? Because we have got... Yeah, 16.
So children between 12 to 15, it's already approved and it's happening. But in those 3 particular groups as priority groups at the moment.
Yeah.
So, but children over 16 up to 30, people over 16 to 39, it is as the Prime Minister announced. Remember when he came on TV, he said, "Don't go and book now. Wait until the 30th and go and book after that," he said.
Yeah.
So,
but yeah, I just want to clarify the 16 to 39. He said that people, that category will get Pfizer, right?
Yes.
12 to 15. What Pfizer. Is their category? Pfizer as well.
Pfizer for them. Children will all be given Pfizer.
Has that started in Victoria?
The children 12 to 15 in those 3 categories that I mentioned are already been vaccinated.
Okay.
But not all the other children. They've not opened it up to all children because then they need to open it up to school children, all school children. So we don't have that supply at this stage to start. So even the federal government today, the chief medical officer, he mentioned it. He said in October, most probably it'll be open to all children 12 to 15, and they'll start vaccinating.
But given the fact that children are getting, they are actually spreading the Delta, yes. Like today's news as well. And I, being an educator, I'm in that setting as well. I mean, don't you think that the government should impose that, like all children should be vaccinated there should be a certain deadline? Just to,
Ideally, that would be if we had plenty of supply. At the moment, we are still short of, and there are a lot of people who still need to be vaccinated in aged care facilities, staff working in aged care facilities. There's lots of other people who work in the front line as well who still need to be vaccinated. So the priority is being given to all those people to get them vaccinated. You clear all that lot. We have still not cleared the full lot, especially the meat industry. Remember last year, there was a big outbreak in the meat industry. And like I went to a meat industry a few months ago. In their 28 years of functioning, last year was the first time they were shut down for 2 weeks. So it is easy to spread because when they are in those chain of working together, there's no way can you separate and put them in individual cubicles. So they're trying to get all those groups. There's a lot of young people in those industries. So trying to get all those people, they're now looking at construction workers because the tradies are easily exposed and all that. So they're trying to get all those groups vaccinated. And then because schools at the moment all shut, so there is still protection at home that can take place compared to them being exposed now. So the moment we have supply, they will open up and get children and the teachers have to be vaccinated. They are not in the priority group as well. So it's an important aspect to consider.
Yeah. Okay, thank you so much.
No problem.
Thanks. Yeah. I've got a quick question on the group who are getting open to vaccination from 30th. So people who are around the age of 23, 24. So in that category, will they be having a choice to opt for the Pfizer vaccine when they're making the booking?
The Pfizer will be their first choice. So they can also, if they want to opt for AstraZeneca, they can opt. Because at the moment, it's 18 to 39, the AstraZeneca is offered to them. So
they're trying to make the booking, but it is saying availabilities will be only after the 2nd week or 3rd week of October.
Yeah, because there's still such a lot of bookings of people who are already booked for Pfizer. So we have to finish those people because our biggest problem is the demand is greater than the supply.
Right.
So we are trying to finish people. And this is why in Victoria, they extended the 2nd dose by 3 weeks to get more people vaccinated by the 1st dose. Otherwise, we'll have to have the 2nd dose ready to treat all the people in 3 weeks' time. So this way, we got a little corridor, and it's fine to keep that delay. So that's why we have delayed it by 6 weeks in place of 3 weeks.
Sure. And in terms of going forward into next year, FY22, is there any sort of, I'm sure there will be hundreds and millions of studies being done as to if people have taken AstraZeneca as 1st and 2nd dose in this year. So in next year, what's the plan? I mean, would they be, can they be taking Pfizer or mRNA?
So I think at the moment they have not made the decision because we know that the booster shots will be coming in. Maybe next year people will have that wide choice of taking whichever vaccine they want because we'll have 4 vaccines. But I always think about the flu vaccine. When we go to get the flu vaccine, there are so many different flu vaccines out there. We never ask the doctor what flu vaccine they're taking. We just go get jabbed and come back home.
Exactly.
So I think you will have the choice. I think maybe we might have new vaccines that will also come up, because as we go forward, we are also going to look at vaccines to treat the new variants as they come, like the flu. And maybe it might be something that we're going to take every year, or every 6 months or something. Yeah.
Thank you. Thank you.
No problem.
Yeah, thank you, Dr. Mohideen.
Just Mohamed, I'm fine.
Yeah, just wanted to say that we'll put this recording in the Facebook link, because unfortunately it didn't work. So we'll definitely put it, and we'll also put all the links and everything. My question is, do you see this, any sort of vaccine like AstraZeneca, Pfizer, doesn't matter, do you see it being compulsory when a child is born, like in the blue book or green book? Is that going to be compulsory for them?
I don't think they'll make it compulsory as childhood vaccines. I don't think it'll be, because lots of immunity will be there from the mother who could be vaccinated. So this is what we're talking about, pregnant women and passing the antibodies. So they will, when a child is born, the child carries the mother's lots of immunity for about 3 months. This is why if you look at all the childhood vaccines, it normally starts after 3 months, lots of vaccines. So I don't think they'll make it compulsory for babies at the moment. We don't know what could be as things things could get worse or things could get better, and we have the COVID under control, because I can't see. It's like, remember when the polio, Rotary movement came up with, to eradicate polio. It's a virus. You can never eradicate any virus. There'll be somewhere sitting somewhere in some corner or something. Somebody goes and disturbs them, and it can all flare up again. Look at Ebola. We thought they'd eradicated. It came out in Africa in the last few years as well. So I think it is something that it can change. We never know what could happen in the future. But I don't think at this stage they will make it compulsory for babies to get vaccinated.
So it's still 12 is the minimum age.
Yeah, at the moment 12. But you can see, like, for example, like, in the recent, if you see the number of cases, even in Victoria, about 40 odd children are below the age of 10 who have developed COVID. There's another 50 odd cases who are sitting in the range of 10 to 15 or something. So there's a lot of children. So it is not, that's why, like, in the first instance, remember they said children don't get COVID. That was the thing with the first round. But now we are talking of a different strain, Delta strain, which is like, it doesn't matter who you are, whether young or old, it's causing harm. So it's something that I think they might, even as they go and they have more studies to confirm. Now we have come to a stage where we can vaccinate children 12 and above. It might become that they might say, okay, we can vaccinate children 5 and above or something. As they do more studies, they get more assurance that children are going to not react in a harm, it's not going to harm them. So I think it's the key things to maybe protect them as much as possible before you give any treatment. Yeah.
Okay, thank you.